Welcome to SMA's Southern Medicine podcast. Practicing medicine in the southeastern United States presents unique challenges for healthcare professionals. The South's heavily rural population and limited resources require medical professionals to be more resourceful in their approach to providing quality care. SMA's Southern Medicine podcast addresses these issues by drawing on the experience of healthcare leaders who provide a multi-specialty, interdisciplinary team approach to medicine for the purpose of providing better care for the Southern patient population. Today we are joined by Doctors Tanya, Nikiforova, and Emmanuelle Yecies from the University of Pittsburgh, who will discuss the evidence and expert-supported best practices for designing and reporting on surveys in medical education research. It has been previously reported that approximately 52% of research articles published in one of three major medical education journals over the course of a year used at least one survey in the methodology. However, only about half of these articles provided sufficient information about survey design and administration. In your upcoming article in the Southern Medical Journal, you and your co-authors address how factors such as inconsistent quality in survey design can lead to altered interpretation of study findings and can also threaten the acceptability of results within the medical education community. This negative response to poor survey methodology may lead to significant consequences, and as such, it is important to design a high-quality survey instrument, and that is what we're going to be discussing today. So thank you both for joining us.
Happy to be here.
Thank you for having us.
Let's start at the very beginning of the process. Prior to preparing a new survey, medical educators should perform a literature search to determine whether a previously validated or utilized survey answering the same questions already exists. Why is this such an important first step?
I'd be happy to take that question. So really, there's a lot of steps that are required or encouraged in order to justify that a survey is appropriate for the questions that are being asked and the overall construct that is being explored. And if you are able to identify a survey that has previously been validated, a lot of these steps may have already been taken by the prior group that may have utilized that survey. So it actually allows you to bypass several steps that you otherwise would need to justify using that survey. If you end up having to design your own survey, then you sort of have to start from scratch with a lot of those pieces that are needed to explain why the survey was the best instrument and that it was a good way to measure what you were trying to measure. So finding the survey that already has been validated and gone through those steps allows you to skip a lot of those. And there's already good data in the literature to back up why you have chosen to use it.
The process of survey development can be divided into three sections once you've determined that a survey does need to be created or developed. Can you please share and describe each of these three sections with our listeners?
Absolutely. So the three-step framework that we present in our article includes 1, writing the question stem, 2, writing the response options, and 3, survey organization. And I'll talk about each of these in a bit of detail. So the question stem is the part that describes the issue that you are asking your survey taker to respond to. And it's extremely important to be thoughtful about how you construct this question stem. So well-written question stems have 5 features that we describe, and I'll go through these. So the first is that they avoid leading or biased questions. So you want to look at your question stem and really think about, are there any terms in there that hold a lot of value? So words like hate or excessive. And using these terms in the question stem can compel your survey to respond in a specific manner, which can introduce bias, which you don't want. So example that we use in the manuscript is the question stem, taking 24-hour call is excessively burdensome. That word excessively in there can compel people to want to disagree with that statement, which again could introduce bias. The second aspect of the question stem to think about is making sure that you're asking about only one concept per question. So we find that this is a very common error in medical education surveys where questions actually ask about more than one concept. And these are called double-barreled, or sometimes they're even triple-barreled questions. So look at your question stem and make sure it's just one thing that you're asking about. The third aspect to think about in terms of question stems is minimizing the use of qualifying phrases or clauses. So the goal here is to try to reduce the cognitive burden for your survey taker, and to keep in mind that you shouldn't be asking people to do mental gymnastics when they're taking your survey, because this can again increase the risk of bias. So a few examples that we use in the paper. So the question that says, I feel fatigued at the end of a 24-hour call, but not a 12-hour call. Do you agree or disagree? Or the question that says, have you experienced fatigue in the past month, but not including in the past week? So these are examples that have these qualifying phrases and that are asking the survey taker to actually do math to answer that question. So we recommend that you look at your question stem, think about, are you asking the person to do math? Is there an and or a but in your question stem? And if either of these are the case, maybe go back and see if you can simplify the question stem. The fourth recommendation is using positive wording in your question stems. And it's the same concept where you are trying to decrease the cognitive burden for your survey taker. Research has shown that mixing positively and negatively worded questions is confusing. And in general, positively worded questions are easier to answer, which is why we recommend sticking to these. And the fifth component of writing high quality question stems, fairly straightforward, but just writing very clear stems that avoid ambiguous or vague terms. So while this seems fairly straightforward, we often do see vaguely worded components of question stems. So for example, in the question, do you regularly report duty hour violations? If you're asking this in your survey, that term regularly can be interpreted in a lot of different ways by people. To somebody, it might mean regularly might mean once a week, or regularly might mean once a month. So just being sure that you're as specific as possible and as unambiguous as possible when you're writing your question stem. So now let's talk about writing your response options. So these are the options that you're asking your survey taker to select from when they're answering your question stem. And overwhelmingly, we will see that Likert scales are what is used in medical education. So this is where you're asking people to rate their agreement with the question, usually from strongly disagree or to strongly agree. There is research showing that these Likert scales, while they're fine to use, they may not always be the best type of response option to choose. And the reason is that these types of scales don't always emphasize the concept that you're actually trying to assess in your question stem. And so you may want to consider whether there are other adjectives that would fit better in the question stem. So I will give you an example. If you are trying to assess a medical student's confidence in their ability to perform the cardiovascular exam, you have a couple ways of phrasing the response options. So you can have a question that says, I am confident in my ability to perform the cardiovascular exam, and have the survey taker use a Likert scale where they agree to disagree. However, I would suggest that a more direct way of assessing confidence would be to use a confidence scale. So asking, how confident are you in your ability to perform the cardiovascular exam? And then having the respondents rate from not at all confident to extremely confident. So after you pick your type of response options that you will use, we do go over some other tips for developing the response options. So this includes things like how many response options are best, and in general, it's recommended 5 to 7. Whether to include a neutral option, how to order response options, and whether to use numerical and verbal anchors, and how to assess demographic information. And we kind of go through all of that in the paper. Are there any of those that you'd like for me to touch on more?
Anything you want to share? I think this is a very complex topic that I think our listeners can really benefit from. Any additional details or information you would like to provide, I think this will provide some great takeaway and tips as they design their own survey. So yes, please feel free to share additional thoughts and insight.
So after you select your response option, we have some other tips for how to make these response options high quality and follow best practices. One question that comes up a lot is how many response options are best? And often you'll see 5 response options used in surveys. Research shows that 5 to 7 is probably ideal. Less than 5 is probably not enough, and greater than 7 is probably too many. So stick to 5 to 7. Some people also ask whether they should include a neutral option. And this is really a topic that's up for debate, and research and experts somewhat disagree on this. And probably it's reasonable to either include a neutral response option or to make people kind of choose, exclude a neutral response option and make people choose on one side or the other. The other question that comes up is whether to use numerical anchors or verbal anchors, or both. And the recommendation is definitely to always include a verbal anchor. Including numerical anchors is acceptable, but the verbal anchor is really the most important part of the response options. And so what I mean by that is, if you have a scale that goes from strongly disagree to strongly agree, and you have 5 options, we recommend not just labeling them 1, 2, 3, 4, 5, but actually including each of the verbal anchors. So writing out strongly disagree, somewhat disagree, neutral, etc. And then finally, just a few comments on assessing demographic information. These questions regarding demographics should usually go towards the end of your survey, which is getting into our next part about survey organization. But in addition, you really want to think about, what are you going to do with those demographic questions? Is it really essential for you to include them? And just a couple of thoughts. So when writing questions assessing gender identity, you do want to be inclusive and not include just the binary options of male, female, but actually more inclusively write questions that provide other options for people to select. And in our manuscript, we kind of give some examples of how to do this based on some expert advice. And in addition, when assessing race or ethnicity, you just want to make sure that you assess the race and ethnicity separately. All right, so finally, in the third kind of component of writing your survey relates to survey organization. And again, the goal here is to make the survey be as easy to take as possible, so that your survey taker is spending all of their cognitive effort on answering your questions rather than figuring out how to navigate the survey. So some best practices. First, you want to think about, can your response options actually be the same for multiple questions? And can you organize them in a grid? Because visually, this is easier for people to take, and that is supported by research that has been done on this specifically. You want to use transition statements between your sections. And when you're thinking about the flow of your survey, you want to think about asking your most topical and most important questions earlier in the survey. And then finally, just think about how to best make your survey visually appealing, and think about this specifically to the format for the survey that you're using. So whether you're giving it on paper versus in a web browser versus on a mobile device, how do you make it look as best as possible? So those are the 3 sections that we've covered. So writing the question stem, writing the response options, and survey organization.
Thank you for delving into that just a little bit. There are things in there that a lot of people, I'm sure, just don't fully think about or realize they may be doing or not doing. And so this portion of the conversation has been very informative. You touched on in this conversation that when designing a survey, biases can be anticipated. You touched on that just a little bit, but how can a survey be structured so as to minimize the risks of biases? Could you maybe go into that just a little bit?
Yeah, absolutely. That's a great question. So I think it's important to recognize that you will never completely eliminate all bias, but it is really important to think about what are the common biases in surveys, and then also what can I do to minimize them. And I'll touch on just two biases that I think are important to consider. So one is acquiescence bias. So this is the tendency of respondents to give positive responses to questions and overall to be agreeable when they're taking a survey. And I think this is important when you're thinking about, again, whether a Likert agreement scale is best versus a different kind of scale like we talked about. Because remember that in a Likert scale, you're asking people to agree and disagree. And so there is some data that shows that people will often tend towards agreement rather than disagreement. And by using a different type of scale, you can veer away from that a little bit. There's also higher risk for this kind of bias when you're using positive adjectives first in your response scale. So it's preferable to probably start with a negative adjective. And what I mean by that is ordering your response options not from strongly agree to strongly disagree. Because again, by seeing strongly agree first and wanting to naturally agree, people are more likely to select those first options, but actually doing the reverse and ordering it from disagree to agree. That can also mitigate this acquiescence bias. And the second type of bias to think about is social desirability bias. So this is the tendency of the survey taker to want to project themselves in a positive light. And this can lead to people minimizing their own unfavorable qualities when taking a survey. And I think it's just, we have to recognize this is not a bias that we can completely eliminate because it reflects human nature. All of us want to project ourselves in the best possible light, but you do want to think about how can you decrease the risk of this bias. One thing to keep in mind is, are you framing the survey as completely anonymous, or are you telling people that their responses will possibly be linked to them? And thinking, and specifically in the context of medical education research, where your students or residents may worry that their responses could be linked to a grade or possibly even reflect on their standing in their training program. In that light specifically, you want to be really explicit in terms of whether the survey is completely anonymous and whether the survey has the potential to reflect poorly on anyone. So often when sending an email with a survey link, we will say your responses are completely anonymous. They cannot be linked to you and in no way will reflect on a grade or reflect on your standing within the program. So by using framing like that before giving your survey, you can minimize this bias.
You just touched on something that I've always kind of wondered about, because typically most surveys say it is anonymous and your responses can't be tied back to you. Are there times when you would want that to be the case? And as I had friends in graduate school who would say, well, if I want the information, maybe a survey isn't the best way to do it. If I don't want it to be anonymous necessarily, we would do a focus group or sort of interviews or things. So is there ever a time when a survey might lend itself to non-anonymity or anything like that?
Yeah, absolutely.
I was just curious.
Absolutely. So there will be times when it may not be best for your overall design of your study for it to be anonymous. You may want to link, for example, one survey to another survey. You may want to link somebody's answers on a pre-test to their answers on a post-test. And in that case, you're often not giving a truly anonymous survey, but you can give a de-identified survey. And so there, the survey responses are not linked to somebody's specific name necessarily, but there is some sort of code that you use to link the pre-test, for example, to the post-test, which could potentially be identified, that you could identify the person taking the survey. I think it's just important to be truthful, to be explicit about whether the survey is anonymous or just de-identified. And if it is a survey that's de-identified but not completely anonymous, to explain to the survey takers what steps you're taking to make sure that they don't get identified. So for example, saying that the code linking your name to your identifier will be stored in a secure private location and will only be accessed by survey administrators and will not be given to your program directors or the people who are supervising you, something like that.
Hey, thank you for that clarification. I was just kind of interested in that part of the process. Surveys should, once it's ready to go, you think they should be pilot tested prior to administration. Why is pilot testing important?
So pilot testing is, we think, an extremely important but also very underappreciated aspect of survey development. So pilot testing will give you the opportunity to really understand things like, how long does it take to do your survey? Are there any aspects of your survey that are confusing? Is there anywhere where the wording is unclear or subject to, various interpretation? And when you're doing pilot testing, it's ideal to do this with people who are similar to your ultimate survey takers. So for example, in our residency program, if we're aiming to survey residents, we will sometimes pilot the survey with chief residents who will not be the target in the survey, but are really similar in terms of how they think to the residents. And the piloting can take on several forms. It can be an informal process where you pick, 4 or 5 people, you email them the survey, you ask them to take the survey and get back to you, let you know whether anything on there is confusing and let you know how long it takes to do the survey, things like that. And you can also do this as a more formal process, which can be sometimes called cognitive pretesting. And this is where you take a more formal approach and sit down with a participant, have them read your survey, and then have them actually verbally restate to you how they interpret each item. And this can be incredibly important to you, making sure that the items on your survey are actually being interpreted in exactly the way that you intended. And this can also be part of your effort for establishing some validity evidence for your survey instrument. So whether you take a more informal approach or a more formal approach to survey piloting, the main thing that we recommend is that you just do this as a really important part of the whole development process.
It was interesting that you said that it was one of the most underappreciated pieces of the process, because it really is. I mean, I've known several people who were just, okay, it's ready to go, and don't look at what, you can't really see the forest for the trees, so to speak, because they've been so involved. And then when the survey went out, that's when they started realizing, oh, wait, maybe we should have done some things differently. And just by skipping that step created more issues than they anticipated. So thank you for sharing and shedding some light onto that part of the process, sometimes referred to as the stepchild of the survey process.
I can share an anecdote about that if that's helpful.
Oh, absolutely.
Yeah. So, the first survey that I designed in medical education, I'd been working on it for months by the time we thought it was ready before pilot testing. I mean, at that point, I had the thing memorized. I was certain about what it asked and what it did. And then we ended up pilot testing it, and I realized that 2 of the questions on there just meant something entirely different to our respondents. And so we were not going to get the answers that we wanted at all if we didn't reframe them. And so that step of pilot testing allowed me to see something which was, it's like when you proofread a paper for the 100th time, like you are not going to find your own typo anymore. And so pilot testing allows you to find that blind spot in some ways where you are so sure of what you're asking and what you're meaning. And if you don't ask somebody else, you may not catch it.
That is so true. And just you think it means one thing and they read it completely differently. I know in our office, I will do proofreading from time to time, and I'll see something completely different. Or when I send my things off to somebody and they'll say, well, I think I see what you were saying, but yet now I can see how you thought this other thing. So the more people who see it after a certain point, I think the better, and it gives you a quality product in the end. So, well, now that the survey has been piloted and is ready for distribution, what should you consider when determining the survey administration, analysis, and reporting?
I'll take this question. So the first question, and really this comes up earlier when you're designing your survey because it may inform the way that you design your survey, but it has to do with the format that you think is best fit for the questions and the type of response that you're trying to get. So you have options for administering a survey type of study. The main three that people use are interview or in-person conversations, and then paper, and finally, the one that we end up being most familiar with is electronic. So surveys that are done by interview can be done in person or by phone. The good news with those types of surveys is that you tend to get a pretty good response rate. And then if somebody needs clarification or to expand on an answer, you're able to do that in real time. Unfortunately, the downside is that those types of surveys are fairly time consuming and expensive, particularly when you need to involve trained administrators, because not everybody will be able to do this without introducing bias. So that's one way to administer surveys with an interview. Paper surveys, you can mail or distribute in person. They also can have a fairly high response rate, especially if you have a dedicated time where you have a captive audience that's gathered and is invested in filling out the survey. The flip side of doing a paper survey is that then you end up with data entry, which is going to be error prone and dependent, both time consuming and dependent on people having reliable data entry skills. And then the other piece is that on a paper, you can't force answers. So people may skip questions, they may cross out answers, and then you end up with having to do interpretation, trying to figure out what they meant. If there's any freehand questions, then you end up having to read people's handwriting. So you end up having that data entry step where there can be a lot of error. Electronic surveys are the third options for administering surveys. The best part of electronic surveys is that they can reach really large populations at minimal cost, meaning that it really isn't time consuming to add more people to your respondent list, just typing extra email addresses, for example. The other positive side is that you can force answers to different items. You can have branching logic. So you can have a little bit more flexibility in how you design your questions and how you focus your respondents. And finally, there's no data entry piece necessarily. You can have that export directly into software programs. The flip side of all of those great qualities is that you end up with often a lower response rate. So you don't have captive audiences like paper. You don't have the conversation piece of an interview. And so the lower response rate can be something that hurts your ability to get good quality data. So figuring out which of those three methods depends a little bit on your survey topic, your resources, who you're trying to survey, and what kind of resources you're working with. So for research purposes, I also want to point out you do need to make sure about consenting your audience and potentially involving your IRB, who allows you to determine what kind of consent you might need. So that's the piece about administration. Once you've actually done your survey, there's a couple of different pieces that I think people need to make sure that they are paying attention to. And those two things are response rate and then non-response bias. Response rate, I think most people know what I'm talking about. It's what percentage of invited participants ended up completing your survey. And there's not really a threshold at which we say this is good or this is bad response rate. But the higher, the better, obviously. The higher your response rate, the more likely it is that your respondents are going to be representative of your sampled population. In the medical literature, we know that we get about a quarter all the way up to 100% response rate. So the range is super wide. The average is about 71%. So in order to improve your response rate, a lot of the things we've already talked about. You want to minimize participant burden, keep your survey as brief as possible. Not every survey is going to be able to cover the whole range of absolutely everything you might be interested in, because the more you include, the longer the survey, the lower your response rate. So it is a trade-off. Ways to increase your response rate. So you may offer an incentive, whether that be a monetary incentive or otherwise. You may be able to send pre-notification. So this is a heads up that FYI, there's going to be a survey coming your way and we would appreciate your assistance in filling it out. You can issue reminders. 3 is really the magic number of how high you can send reminders before it starts being counterproductive or annoying to respondents. And then if you're able to emphasize the importance of the topic and really invite your participants in a positive way, that you value their opinion, that their time is really helpful, that this important topic will be better understood with their help. Those framings allow you to build collaborative mindset with your participants, and they're more likely to want to be helpful to you. It is really important to make sure that you keep track of your response rate as you are administering your survey. And if you're able to figure out why people are not responding, that may help you understand your answers better. So that gets us to the second concept I had mentioned. So we talked about response rate, and now let's talk briefly about non-response bias. Non-response bias is the idea that there may be systemic differences between people who take your survey and respond and those who do not, in a way that affects the validity of your answers. So it doesn't really matter how high your response rate, that is not a super great predictor of whether you may have non-response bias. So you may want to look into the ability of doing some non-response bias analysis on the survey, regardless of how high your response rate was. Obviously, if you get to 100%, you may be dispensed from doing that. So there's previous papers that have discussed how you look at non-response bias. And to summarize some of the recommendations, they suggest comparing responses between early and late respondents. So there's a difference between the people who fill out your survey the first time you ask and the people who respond the third time you ask. That's something that's worth noting and perhaps hypothesizing. You may, if you have the resources, contact people after the survey administration is completed who did not fill out the survey and ask them to do either a brief version of the survey or let you know why they didn't participate. And then finally, if you know anything about your survey takers before you send out the survey to the population, you may be able to do some analysis there. So if you know, for example, that half of the people you're sending it to are second-year residents and half of the people you're sending it to are third-year residents, but then the surveys you get back in the demographic section are 90% third-year residents, then you may have a non-response bias there just from what you know about the greater population compared to who actually filled out your survey. If you are doing any analysis for non-response bias, super important to include in the manuscript for clarity, but unfortunately, it's something that is really left out quite frequently.
I don't think people fully appreciate sometimes what all is going on with surveys and the hope that people will complete your survey. And, you know, I try to be mindful, having been on both sides of the fence there, that when I get surveys and I think, oh, you know, another survey, I do try to fill them out and I kind of look at them with that pair of glasses to see the questions. And so it's just kind of, this is just, I'm learning a lot from this conversation. And again, I appreciate your spending some time with us today to talk about it. When now your survey is done, your information is in hand, and you want to publish or to submit this to a publication. When preparing the manuscript or a manuscript for submission, what information from your survey should you include in the method sections? I know with our journal, sometimes the method sections are a little more robust than in others. And so are there any sort of set parameters or insight you can give as to what should or maybe even should not be included in that section?
Yes, absolutely. I think this is a really important thing because a lot of times people do a ton of work up front in preparing a survey, and then by not sharing all the work that they did, they don't end up giving themselves enough credit, and that can be a cause of rejection for a lot of manuscripts. So really, a lot of what we've already discussed, if you did it, include it in your manuscript. So any steps along the development of the survey, what literature searches you may have done, who you involved in developing the items, how you pilot tested and revised are all things you want to include. You should try to describe your survey as much as possible, including how many items, what types of response options. If you're able to include it as a supplement, that is also something that may lead your reviewers and your readers also to find and understand better how your survey helps answer your question. It also helps any future researchers who may want to use the survey instrument that you've used to assess something fairly similar. The methods section should talk about survey administration. So like we talked, the interview versus paper versus electronic, how you contacted people, if you offered them incentives. There are checklists available in the literature that sort of talk through some of the pieces, but I would say if you are unsure, more is more. So the other piece that we haven't touched on directly, but has come up sort of sideways a few times today, are the idea of reliability and validity. So I can expand on those a little bit, because if you have any of that to discuss in your manuscript, that will strengthen the point that you're trying to make to your readers and the research that you're presenting. So reliability is the idea of how reproducible your survey is. And it can be reproducible in a variety of different ways. So it can be across different people, which is called inter-rater respondents reliability. It can be over time. So if you survey people at 2 time points, would you expect their answer to change? And if the answer should not have changed, then you should be able to see the same response over time. And then within the instrument, which is internal consistency, which is the idea that if you are basically asking the same question 2 different ways, do you get the same answer? You can do reliability testing during pilot testing or after survey administration. There's sort of no end to how much reliability testing you can do. So you sort of have to find how many resources you have and how much time you can devote to it. Validity, on the flip side, is whether your survey actually measures what you intend to measure. So at the very least, content-related validity is whether your survey captures all the pieces of the concept, and that piece is done during survey development. So you can include experts during your survey development at the very least and ask them to review your survey and ask them if they want to add items that they feel would be important to complete the assessment of the construct, if they feel like some items are unclear or should not be included, and whether they feel like everything is appropriate, clear, and complete. Cognitive pretesting is something that was already addressed earlier, but the idea that you have your participants interpret your survey out loud for you to make sure that it is to them what it is to you. And then anything else that you can show along the way about validity or reliability, that you're measuring what you say you're measuring and you're measuring it in a way that can be consistent and reproduced, will allow your survey to be more valid. Unless the whole point of your research project is to validate a survey, we recognize that you're not going to be able to devote hours and hours and unlist funding to this. This is something that can be a research project in and of itself. So I think reviewers understand that there are limits, especially in medical education, to how much reliability and validity you can show. But the content experts and any kind of reliability analysis that you can provide, if you've done it, you should include it in your manuscript.
Through your own experiences with surveys, what do you believe are some of the most common mistakes medical educators make when designing and administering surveys? I know we've touched on some things such as bias and maybe not pilot testing, but are there other things you've learned along the way that our listeners could benefit from?
So I would say my biggest recommendation is to realize that making a survey is an endeavor. So sometimes it feels like the easy way out. If you want to ask a question, you're interested in something, and you spend a few minutes and you can't seemingly find something that's perfect already in the literature. And so, we'll just make a quick survey. And I think I just want to impress on readers that that is really not the right mindset, because a quick survey is going to be missing a lot of these pieces that we've talked about. And you really do need to put a lot of thought into how you're framing your questions, who your respondents are, who you're involving in the process. And really, if you're starting to design a survey from scratch, it is going to end up being fairly time consuming. And so I think that's the biggest mistake that people make is underestimating how much effort and how much time and resources designing a new survey really takes.
And I completely agree with Dr. Yecies. And I think I would add just 2 things. My biggest advice is to do 2 things. One is absolutely review all of the relevant literature before you go into the survey design process. There's nothing worse than administering a survey or being at the end of designing a survey and finding out that there's already another survey out there that beautifully assesses the exact thing you wanted to assess and could have been used all along. So do your due diligence up front and review all of the relevant literature to make sure there aren't other surveys out there that you could borrow from or that you could use. And the second thing is just, again, pilot testing and remembering that once you give the survey, there's no going back. You can't fix the survey. So it's really important, exactly as Dr. Yecies said, to put in all the work up front that you need to make sure that you're administering a really high quality instrument.
I want to thank you both so much for being here today. And as we conclude our conversation, do either of you have any final thoughts or words of advice you would like to share with our listeners?
Well, what I was going to say is just that I did not fully recognize before what a rich body of literature already exists from the social sciences on survey design. And I think as medical educators who use surveys often, we in the past maybe ignored or weren't aware of this body of literature, which I think sometimes perpetuated the cycle of suboptimally designed surveys. But I think by looking at this literature that is already out there and has been out there for decades and really aligning our process of writing surveys with these evidence-based best practices, surveys can continue to be a really extremely useful, convenient, and important way of conducting medical education research.
Yeah, and I would add, there are people whose entire life career is being experts in statistical analysis and validating surveys. And if you have access to those people at your institution, I would encourage you to take advantage of their expertise. They have invaluable knowledge. But if those people aren't available to you or you're not sure how to access them, then refer to articles like ours. There's other articles that also summarize a lot of what we've discussed that are referenced in our paper. You can do some good quality work even without expert guidance. And don't hesitate to reach out to people who have already done this in your own institution or elsewhere. I know people have reached out to us to review their surveys in the last few months. And I think getting another set of fresh eyes on a survey can never hurt. At best, you can always discount what they say if it doesn't line up with what you were interested in hearing, but it doesn't hurt to hear it. And sometimes you may get some really good insight.
Thank you again for joining us today. And again, we have learned quite a lot, and I'm sure our listeners will find some very valuable information, not only in this podcast, but in the article that will be coming out in the Southern Medical Journal in the very near future. So thank you both for being here today.
Our pleasure. Thank you so much for having us.
Yes, thank you so much.
We hope you enjoyed the practice of medicine. For more episodes in this series or SMA's The Business of Medicine podcast, go to sma.org/podcasts or subscribe to us on iTunes, Google, Spotify, or wherever you get your podcasts. For more information about SMA's mission, please visit sma.org. And thank you for joining us.